All right, good afternoon, everyone. Thank you all for being with us today, and thank you to those who are tuning in. I'm going to go ahead and adjourn the Labor and Public Employees Committee Task Force to study the state workforce and retiring employees at 3:04 p.m. And I will open the floor at this time for welcoming remarks, starting with my co-chair, Senator Kushner.
Thank you, Representative Porter, and thank you for chairing today. You did say you were going to adjourn the meeting, and I think you meant you were opening.
Convene. Yes, I want to open the meeting. Thank you for that correction. We're just getting started.
I won't keep you all. I'm excited to see you, and we have a lot of dynamic presenters today. So I will keep my remarks to welcome, and I look forward to hearing from all of you today. Thank you.
Thank you. As we convene, I will go to Representative Aurora.
Thank you, Madam Chair, and very glad to be here. And thank you for all of you for your insights. And I'm looking forward to all the conversations. Thank you. Back to you, Madam Chair.
You're welcome. And Representative Mastro Francesco, you have the floor, Madam.
Thank you, Madam Chair. Can you say that 3 times fast?
I don't think so.
Welcome, everyone. It looks like we have a full agenda today, and I'm really looking forward to listening to the presentation and learn more about what you have to say. But thank you for participating today. Thank you, Madam Chair.
You're welcome. Thank you. And I don't see any other legislators on, so I will just say that I'm looking forward to this presentation that we have coming up from Dr. Pitts, as well as from state employees regarding these staffing shortages. I always say the people closest to the problems are closest to the solutions. So I'm really looking forward to hearing from you all. And with that, we will get started with Roman numeral 3. And this will be a presentation by Dr. Stephen Pitts with the University of California, Berkeley. Dr. Pitts, you have the floor, sir. Is he with us?
Yes, I was muted.
Oh, there you are. Okay, I see you.
Okay?
I see you.
It's okay.
Welcome.
I'm glad to be here. Thanks for having me here. And to make it clear, I'm retired from UC Berkeley. Very good. I was telling folk I kind of rescheduled my massages, got out my rocking chair to come see you for a little bit. But I'm glad I can help out, to be honest. This work you're doing is my passion. And so I'm happy to be helpful any way I can. Real briefly, who I am, Chicago born and raised, by the way. And from there, went to Harvard for my undergraduate. And from there, went to Houston to do some political work, some organizing. And at a certain point in time, things changed, a lot of different dimensions, and went to grad school there. Got my doctorate in economics from the University of Houston. And then in 2001 rather, I came out here, I'm in Oakland, California, back to the Bay Area, to work at the Center for Labor Research and Education. We call it the Labor Center, to do good work, trying to get data and understanding of what's happening around with working people around the country. And been there for 19 years, and I had to call it quits in July 2020. I planned on seeing my grandson outside New York City, my other daughters, but I guess COVID had another plan. And so I've been stuck here during retirement. I'm glad to help out. What I wanted to do was simply present to you some data I pulled together. And I think I also submitted to folk a 3-pager. It was to be a 2-pager, but now it's 3 pages. Just kind of, if you want to in hand what I have. The PowerPoint is yours to have and play around with. I'm assuming you won't alter it, by the way. But seriously, it's yours to have and use as you need to. But I do want to kind of walk through the PowerPoint. If you see me looking this direction, I'm not ignoring you. I have 2 monitors. And sometimes I kind of go back and forth on things. I'm not trying to do something else while I'm talking to you at all. So at this point, one last thing. I hope that you will ask me questions while I present, if the question is about the data itself, meaning what does the slide say? Sometimes we have questions on interpretations, a question on why. I want to hold kind of the interpretation, the why, for afterwards. That could get into a long conversation, but if a slide is unclear, I would much prefer to clarify it when I present it than wait till the end of everything itself. That work for people? And if you get kind of verbose, so this is by my rules, I'll simply find some mere daily text and shut you up and go forward, okay?
And let me just interject really quickly. Are you going to be sharing your screen?
I'm about to in a second. Yep, that's the idea.
All right, thank you.
That works for folk. And let me go back here. This is not my expertise, by the way. We'll see how it works. And now you see it, right? First slide. First. Did everybody see the slide? Make sure we're on the same page. You have a very long name for your task force, by the way. That keep me active for a long time. I don't know how you developed that long title. That's fine. I thought this quote's a good quote to begin the conversation with. You know, it's not only the day after the official holiday of Martin Luther King's birthday, but also I think it sets a tone for both my life passion and my work and your work as well. And when he said in a month before he was killed, the problem is not only unemployment, it is subemployment. People work full-time for jobs for part-time wages. To me, that's very crucial. And in different dimensions. You know, oftentimes when I look at what I call the Black job crises, I understand there's a lot of focus on unemployment for righteous reasons, by the way. But I think the reality is that for most Black folks, they have jobs. This is so many low-paying jobs. And so it's important, I find, to expand the conversation over beyond just unemployment, also low-wage work. And the challenge is also, what do you do to solve that problem? I was talking to a friend of mine yesterday. We kind of chilled a bit on my long weekend, but his holiday actually. And we were talking about some of the growth in Oakland. And his question was, what do you do if these firms come in who don't pay good wages? And I think it's to come upon the public sector to find ways to get better wages. But to the extent that firms choose not to, one way to address the problem is simply to find various ways to increase the wages that people receive. And so when I looked at my looking back across kind of national stuff and looking primarily focused on the Black community, that we found there, up until, say, the Civil Rights Movement, 3 pillars of, might say, stable Black communities. It's employment and really entrepreneurship, because Jim Crow forced folk into certain business practices. That's a stable pillar for Black community wealth. You also had the industrial jobs that were unionized. And because they're unionized, coming out of the Depression, had good wages, another pillar for Black stability. And also you had simply the public sector, paid better. And what we've seen since the last 40, 50 years, you've seen, as we know, the deindustrialization, that kind of taking that pillar away at some level. We've seen kind of, because of the good things of eliminating Jim Crow, a different type of Black entrepreneurship, which is taking away one of the pillars in some ways. And so I always think it's important to remember the 3rd pillar, that's the public sector. This is a pathway to stable jobs, stable communities that we shouldn't forget. I never really looked at Connecticut much, by the way. So I enjoyed the opportunity to go into Connecticut, and I did a brief dive, and I want to show you what I came up with. But the 2 key issues I want to focus on, one is to talk about the racial and gender income inequality within the workforce in Connecticut. And the second major point to explore is the question of the impact of state employment on racial and gender inequality. I want to keep in mind that I'm assuming, I know that you have clearly local employment there in the public sector. You also have federal employment. When I talk about state employment, it's just state employees. And so I'll talk sometime about the private sector. I'll talk about state employment. There's people between I'll talk about. That's life, right? To make sure we're clear. So those are my two focal points. A quick summary, if you want to kind of give the summaries quick, and you can kind of turn me out at this point. That under the first issue of racial and gender inequality, 3 important takeaways. Some may be obvious, we have data to back it up, that Black and Hispanic workers earn less than white workers. If you break it down by not just broad Black and Hispanic, but by gender also, you see Black men, Black women, Hispanic men and women, and white women also earn less than white men. You also see that if you talk about kind of, I'm doing what I call later on a tertile analysis, where I take the workforce and divide into 3, lower third, middle third, high third income-wise. You find that Blacks and Hispanics are disproportionately represented in lower income portions of the workforce. In terms of the second sort of key issue, the impact of state employment on racial and gender income inequality, one is that it's fascinating in some ways, but it's kind of almost like a dud in other ways, that the inequality I mentioned above, they're less among state government employees. So we'll still see some differentials there by race and gender, but the gaps are smaller. And so to the extent we talk about trying to reduce inequities, that's one thing government employment does. What's also interesting is since the Great Recession, we see that some lessening of income inequalities, but the lessening is more amongst the government employees in the private sector. You could flip it around, but to the extent we see a rising amount of inequality in the private sector, we don't see that matched in the public sector. And lastly, we just examine the Black and Hispanic communities themselves and examine what sort of jobs support higher incomes in those communities. Once again, there are jobs in the public sector. And so what I say there in the bullet point is that the state government workers comprise a disproportionate share, higher share of higher income segments, that higher tertile I talked about in Black and Hispanic communities. And so those are my key takeaways. Let me kind of put some data there to back them up. On the first point, we're looking at median income. By the way, the data source is the American Community Survey. In the handout I passed out, I gave the full citation, by the way. It's an annual survey done by the US government. I guess my retired years, I kind of forgot to properly cite my slides, but you lose some skills when you retire. I'm going downhill from here. So citation-wise, the data is from the American Community Survey. I looked here at the year 2019, and we're looking at median income. And we see there's simply a parity, meaning parity with white at this point in time. If parity means that the ratio should be 100%, for Blacks, it's 66.7%, for Hispanics, 60%. So roughly 2/3 or so, we see, looking at full-time workers in Connecticut in that year period. This right here, once again, is for all full-time workers in Connecticut. When you break it down by gender in more detail, you see that once again, the bar of parity, which in this case is white male, 100%. You see once again, the breakdown, Black men, 64%, Black women, 61%, Hispanic men, 58%, and so forth. So you see once again, the inequality that exists. I mentioned my tertile analysis, I call it. And tertile may be a strange term. So the idea is simply, once again, you take the workforce, divide into thirds. And what you see there is that you can get a sense of the total workforce, then kind of, I'll call it orange, and the share of Black Hispanics in the upper tertile. And you see once again that Blacks and Hispanics are underrepresented in that tertile. And so if you look at the overall workforce, 10%, 10.3 is African American, 15.9 is Hispanic. Once again, if we had parity, you'd find the same figures in the upper tertile, but you don't. You find that Blacks is 5.1% of the upper third income segment of the Connecticut workforce. Hispanics are 7.0% upper tertile, showing once again the disproportionality. By the way, I tried to not have tons of slides. There's tons of data, by the way. So if you want some more data, I can give it to you, okay? More slides later on, but I'm going to move on to the next point. It looks at the impact of state employment on racial and gender income inequality. What we're seeing once again is looking at a median income, comparing the private sector to state government employees. One of those gray bars for the parity. Right now we're looking at Blacks and Hispanics compared to whites. And you see once again on the private sector, looking at Blacks, as I said before, Blacks, so 66.7% of the income raised by whites. I apologize. While for on the public sector, that rises to 94.4%. As I said before, we see greater equality in the public sector. Same thing is true for the Hispanic community as well. Same approach, hope it's not confusing, same approach, comparing Blacks and whites, this time across time. I mentioned once again the kind of the differences. And so we have those 6 bars on the left for African Americans, the 6 on the right for Hispanics. Of those 6, I call them the black bars. The 3 on the far left would be for 2007. And so you see kind of the gap there. And so if you look at the blue bar, it looks at the black-white comparison for the private sector median income. And the private sector is 67%. Looking at the next set of bars, next set of 3 bars, it fell a bit to 66.7%. So comparing the black bars on the left, the 2 blue bars, the 67.3% is for what happened in 2007, the 66.7% happened in 2019. If you look at what happened in the orange bar, okay, same time periods we're comparing now for the public sector, for the state government workers. We see, in both cases, we see greater parity, by the way, but the jump was more going from 07 to 19 compared to what happened from in the private sector. So once again, it's an example of the importance of the state government for reducing income inequality. The same data shown in the Hispanic community. Once again, in 07, the number was 55%. Looking at the private sector, we saw a bit increased parity for Hispanics in the private sector, going to 2019, 55%, 58%. We saw a higher starting point for Hispanics in 07, and even higher growth in growth looking 19. Just give you a sense of the role of the public sector in reducing income inequality compared to the private sector. That's a lot of stuff in that graph. Is that graph clear, at least what it says? Going once, going twice. All questions gone, y'all. This last slide is just to look at the question of the importance of state government and communities' well-being. What we have here is examining the share of workers within the community. And so the blue bars talk about the share of first Blacks, then Hispanics and whites in state government. And so 6.7% of all Black workers are in state government. For Hispanics, 3.6%. For whites, 3.8%. Once again, seeing kind of different reliance on state government. What's fascinating, though, is that while just 6.7% of African Americans are in the state government, if we examine that upper tercile in the Black community, that 16.3% of all kind of upper tercile African Americans are from state workers. So almost got a big pillar. We examine the Hispanic community. Once again, while 3.6% of Hispanics work in state government, we finally examine the upper tercile in the Hispanic community, 9.4% work in the state government. And it's fascinating, that kind of bump up is far, far less than the white community. Just going from 3.8% as a share of overall white workforce to white state employees and representing 4.5% of all whites in the upper tercile. Just trying to give you a sense that when we look at kind of pillars for stability, for community stability, that state governments are an important anchor for well-being. So those are actually my slides. Let me stop sharing my screen. And let me also get rid of this PowerPoint so I don't see things on my side. Any questions that people have? That was kind of quick, actually, y'all. Sorry.
Well, first, I just want to thank you for the presentation. And I found all of that quite interesting. I'm more interested, though, to hear from the members on the committee right now. So I would ask that anyone that does have questions to please raise your hand. Yes, Senator Kushner, you have the floor, madam.
Thank you. And thank you, Dr. Pitts, for that presentation. I think it's very important to look at what it means to have full state employment. When we have really a robust state government, then we know it's going to benefit not just those state workers, but the whole community. And I think that's an important point. We also know, and have had discussion on previous task force meetings, that we are in a moment because of the retirement cliff that we're facing here in Connecticut. We're at a moment where making sure that we are intentionally, consciously developing diversity hiring practices so that we, in fact, maintain these advances that you just documented. Because if we don't, we could slip backwards. And I don't think anyone wants to do that. So I think that's one of the important lessons that you're underscoring for this task force. I thought all of the slides were really, really helpful. I'm worried that I might not remember when I look at them later exactly what they mean. So I hope you're available to answer questions down the road. But I think that that you sort of went to the core data. I think when you say the top third tertile of employment in Connecticut or of income in Connecticut, it would be helpful if you could share with us, if you have the data, what sort of income level are we talking about? Because, I know from other presentations that the top 1 or 2% can be, really high up there. But when you get to the top third, what approximately is the range of what's sort of the low end of income in that case?
Yeah, I should have I don't have it in my top of my head, be honest. I can, in 5 minutes, get it for you, by the way. I don't have it handy to give you a good figure. That's one interesting thing, by the way, that there's so much focus on top 1 or 2% and the incredibly high numbers that seem from most people out of their reach. When we talk about the entire third, it drops a lot. But I'll get it back to you. I really will, okay?
That would be great. Thank you. And thank you for the presentation.
All good. It's my pleasure.
Yes, Representative Mastro Francesco, you have the floor, madam.
Thank you, Madam Chairman. Thank you. Great presentation. You have a lot of good information there. I was just curious, will you be sending along that PowerPoint to us? Would we be able to get a copy of that?
I sent it to, I think, Dan, he has it. So
Okay.
maybe you can negotiate that. Maybe it'll cost you something. I don't know. We'll find out.
Thank you. And then also on the, when you sent over the presentation, do you have links on the bottom there that shows where the source came from that data? Are there any
it's in the
links
handout.
there?
I'm sorry, I apologize. I can tell you orally in the handout I sent also to Dan, a 3-pager, kind of gives you data in another format. It's the basic data source of the Census Bureau. It's the American Community Survey.
Okay.
And in particular, I access it through the site called IPUMS. It's the Inter-University Public Use Data something. Okay. They have it here, the exact citation. But it is the data itself is the American Community Survey. Yes.
Survey, and that's from the census?
Yes, it is.
Yeah.
So about maybe 12 years ago, the government began to supplement the normal sort of decennial census. We fill out forms every 10 years to an annual survey. They call it the American Community Survey.
Yeah.
And they do it so we can have more kind of current data, see trends more accurately instead of waiting for every 10 years, and things change a lot inside the 10 years. So it's the American Community Survey, an annual survey.
Okay, and that's current. That's the current annual survey.
Yes, I gave it 2019 data, yes.
Great. Thank you so much, Stephen. I appreciate it. Great presentation.
Oh, good.
And next up, we have Representative Aurora.
Thank you, Madam Chair. Thank you, Mr. Pitts, for this excellent numbers presentation with a lot of numbers. One of the questions I had was, to identify the problem of what is driving this gender as well as race inequity. Is it the composition of the jobs, or is it a dispersion within the job? And I'm hoping you can understand that because if you looked at private, and this is a research I looked at very recently, when you look at hospital data, right, private hospitals, you see that they pay, whites make a lot more than others. But then when you see the actual composition, there is only 5% of physicians who are doctors who are Black, whereas there is 11% of RNs. So basically, if you adjust it by occupation, becomes different. When you said, okay, how do Black doctors and white doctors and Hispanic doctors and Asian doctors compare, then everything was actually, there was no statistical significance to the differences, or it fell quite drastically. So one of the problems, challenges which has been identified and which gets muddled up a little bit is that the nature of the jobs being done or the occupations being done need to go up or in the value chain or in the income chain. And it's not that within an occupation. So the reason I'm asking you is that, do you have the research which is, or have you done a study which normalizes the actual occupation? Because state government by definition has less dispersion. Whereas private sector, for example, think about a hospital, there's somebody who makes $10 an hour in a hospital. There's somebody, cardiologist specialist, who makes $15,000 or $500 an hour, whatever, a huge number, right? And we want to say, well, are the jobs dispersed at the $10 and the $500 equally amongst everyone? Or is it that one community is getting all the $10 jobs and one community is getting the $500 jobs? And then you have to say, well, you got to move everybody up, in the educational spectrum, but because obviously the $10 person cannot be the cardiologist, and the cardiologist will not do the $10 job. So my question for you is it a skills dispersion which is causing this, or is it an active aspect of a fact that, listen, for the same doctors, for the same cardiologist, we have this difference between what we are paying a man versus a woman, one race versus the other race, because those are kind of, very, very upsetting. If two registered nurses are getting paid differently, and we got to do something immediately. But if we have more registered nurses versus doctors, that's a 10-year program where we got to encourage that education or that moving up that curve. And so there are two different. So my question to you again, let me put it as a question rather than a comment, is: do you have occupation? Do you have these numbers by occupation rather than just the private sector overall?
So the short answer is I don't right now. But give me a longer answer, though, in response to the longer question, which is fine, by the way. If you examine the question of differences in income, you can examine kind of a couple of broad buckets as a source beyond what you said of skills, by the way. You can talk about it first in kind of the labor market, the non-labor market. And so the problem may be nothing in the job market, but maybe prior to that, if we see problems in the education or healthcare or housing or criminal justice systems, that can mark folks that go into the job market. So the first question to look at simply is that impacting the outcomes I showed you? It's a question. Second, within the question of the labor market, there's three broad buckets to examine. One is the one we focus most quickly on, the hiring piece. Either we do or don't hire somebody, or we pay them less than the same job as a white person. The other problem is the question of the the issue of occupational differences or industrial differences. Industries, occupations may be different. And so what needs to be accounted for, if I did more analysis, is simply controlling for industry, also controlling for occupation, what's the differences to be found. It's important in solving the problem. I mean, right now I'm trying to simply give you a sense that the problem exists. The issue of magnitude is extremely important. If we had limited resource, the issue of where do we place our energies? Is it in the housing market? Is it in the labor market? Is it in different places? It's important. But once again, kind of the framework, think about problems outside the job market, problems in the job market. Within that, inside the job market, the problem of discrimination in hiring and placement, or is it a matter of simply kind of sliding in occupations or sliding in industries?
Yeah, yes, no, that's very helpful, because we have to break down the problem in those buckets. Because when you said underemployed, I'm sure Robin, Representative Porter, and myself were thinking about the class of people called legislators in Connecticut who are definitely underemployed, who work full time and are paid.
I'm sure Dr. Keenan made that
plenty.
I'm sure Dr. Keenan talked about legislation when we made that quote. I'm sure you did.
No, thank you very much. No, we joked that, all our legislators pretty much work full time, but end up, it's a part-time job. But but I do agree that, that we have to break it up into those two buckets, because some of the private sector jobs pay very, very much higher, than government jobs. And we want to make sure that all communities do have a say, or management jobs in businesses pay a lot, whether it be, obviously, as I said, doctors, physicians. I want to make sure that those kinds of jobs are well distributed. And there's perhaps, I think you pointed out, well, it's not about in the purvey of our job here, or our task force here, but it's a very important thing to consider as well. Thank you, Madam Chair. And sorry, please, if you were.
One last thing, I know we got to move on for a lot of reasons, but one quickly, it's important to note that we've seen a rapid erosion in job quality in the private sector. Talking to my friend yesterday, he's looking at some jobs in the data center area in the South Bay by San Jose. We found that that's the people who have the big old kind of whatever, computers that hold the cloud on the ground, actually. And you find there that Google, for instance, they'll have maybe 10% of their workers being their employees, and they contract out for the other 90%. And so it's not just a matter of public versus private. What sort of mechanisms should exist to ensure that workers in the private sector also get a fair shake and good wages? And a lot of times it comes from public policy. Some of it comes from unionization itself, to be honest. Let me go on.
Thank you.
Thank you.
Back to you, Madam Chair.
Thank you, Representative. Next up, we have Mr. Livingston. You have the floor.
Thank you, Madam Chair. I think I know the answer to this question, but I'll be a lot more certain if I hear it from an expert. So can you talk, you started with a quote of Dr. King about underemployment and about employment basically in non-living wage jobs. What do these slides show about the significance of, livable wage jobs in the public sector to the Black community and the Hispanic community?
I think that last slide tells a stronger story in short form. We examine what I didn't show with the fact that Blacks and Hispanics are disproportionately not in the upper tertile, by the way, okay? But given that folk are there, we see this one reason for Blacks and Hispanics being in the upper income strata there because of state employment. And so that to me is an important takeaway, that if you examine what mechanisms allow Black and Hispanics to get into the upper tertile, an important mechanism is simply state government. And that can't be discounted in any way, shape, or fashion.
Okay. And I guess if I can just ask one other question, Madam Chair. So, we've worked a lot with comparisons of state employee wages and private sector wages, and they're done with multiple regression analyses, and they actually hold or they hold it against state employment that it is less regressive in terms of pay for Black and Hispanic workers. In other words, since they assume that Black and Hispanic workers in the private sector make less, they actually hold it against us. So
what do you mean hold it against you? What do you mean? What's it mean exactly?
So in other words, one of the factors they regress out, in effect, is the presumption that Black workers make less than white workers. So just like they take into account differential levels of education, they take into account the fact that we have a higher percentage of Black and Hispanic workers, and they by regressing that out, they actually make the public employee wages look higher. So when you did this analysis, am I correct that you didn't regress out? You actually looked at the raw data and gave us the information directly. Is that right, or did I miss that?
That's correct. You look at the raw data. Regression analysis, right? That's something I call my horror story from grad school, that I still do, by the way. It's incredibly useful. I mean, it's incredibly useful at isolating problems, controlling for factors that may cause certain things happening. Incredibly important. You must use the tool well. So if the question is, do we see, I'll call it blatant discrimination in hiring, or then it's very important to place out the idea of what could account for the differences. And so if the public sector could account for it, ignore that, do you see the problem existing? That's very important. But that's not the only question to ask. Another question is, if there's sliding in certain occupations, sliding in certain industries, why does it exist? And sometimes one regression can't deal with that, no matter how you use it. If the question is the impact on the community of a certain industry, you can't ignore that. That's the real world. So it's important to make sure that the proper questions being posed, to make sure we interpret the data correctly. And so the question is, if you ignored the presence of state government, would you have less differential? Answer is yes. But you're ignoring real lives, by the way, okay? And so the question is, what provides real well-being for communities? You got to include that real world. So there's important tools that can be used and misused.
Thank you.
All right, and up next we have Dr. Al-Qadri.
Thank you, Chairwoman, Representative Porter. And Dr. Pitts, thank you for your presentation. This is a really excellent presentation. I think the main utility of this presentation is showing the importance of public sector employment to reducing inequality in terms of pay. And then the fact that we have a high degree of unionization in the state workforce might also be helping, because I'm working on a study right now that shows that unionization reduces the gender gap, almost eliminating it in some cases. And there's probably something to be said about that. Of course, ACS does not include unionization status in it, unfortunately, and you won't be able to get that much. But I, to an extent, I agree with Representative Aurora that the data does not get into occupations, and as we know, gender gaps, at least for women, is substantially accounted for by occupational segregation and the position level segregation that occurs in the workplace. So the gap is reduced substantially once you compare people within the same occupation and the same position level. So that's important to keep in mind. Now, to answer Representative Aurora's question, we do have a report that we did about a couple of years ago, or a year ago maybe, that shows the pay discrepancies by occupation and by position, essentially by job title, and by EEOC category as well. So we have that data, and I'll be more than happy to share that with you, Representative Aurora. I'm happy to share it with everybody if more people are interested in that. So we do have the real data that comes out of payroll data, basically, that shows that discrepancy and breaks it down further. But I do think the importance and significance of today's presentation is showing that public sector employment in general and state employment, and specifically, helps provide opportunity for people of color and for women in terms of working in a workplace where there's not a big gender pay gap. Thank you.
I want to also emphasize the importance of looking at occupation and industry.
Mm-hmm.
So fundamentally, we examine the public sector's and industrial analysis. You can look at high tech, industrial, fast food industrials, and sometimes while people focus on occupation, I want to become a doctor, I want to become whatever else, which is occupational analysis. I think in terms of the tools at the disposal of the public sector, oftentimes the industrial tools are stronger. And so a firm may want to come to Connecticut and bring a certain factory, right, certain activity. They're bringing an industry there, maybe influence land use, those sort of things. So right. It's important to examine both occupation and industry. We examine both the sources of the differential and the tools at disposal to alleviate them as well. And also what's missing, by the way, is the value of the public sector to the public. You know, this is not simply an analysis over what job pays the most. The question is always an issue of how do we serve people? How do we serve folk? And so hopefully that we won't forget that kind of, oh, by the way, we're actually serving the public, and making sure that we don't forget, that should be part of our overall analysis as well. That's all.
Thank you.
Thank you. Up next, we have, sorry about that. Christian Spencer, I'm sorry. You have the floor.
Thank you very much. So I appreciate your presentation, Mr. Pitts, and I have a question sort of off of what you were just saying there. Are there any industries that you have found in your research that are sort of analogous to these public sector jobs? Is there any where the, you know, it's closer to approaching parity there?
Let me give us a broad answer, not a detailed one. I forget for this. When you look at the period time after World War II, roughly 46 to the mid 70s, if we could examine some of the wage differentials in the heavily unionized industrial sectors, you saw a similar situation.
Mm-hmm.
But because of unionization and the associated contracts, you saw less differential. When we saw the differences by race and gender in those unionized industries, it largely because of occupation, where maybe what happens is that for a variety of reasons, Blacks and Hispanics or women are slotted in the worst jobs. But then if you compared those worst jobs to the private sector equivalencies in terms of skills, there'd be better pay. And so I think that if we examine those sort of unionized structure industries, you'd find lesser inequality. And then the primary question is some sort of intra-industry problem because of occupational slotting.
Understood. And I appreciate you bringing up some of the environmental factors, you know, housing and, you know, education, some of the other factors that you brought up there. And so I wonder if, you know, we're talking about this and talking about the parity, and this is more of a comment than a question. I'll be done in just a moment. But you know, we're talking about the closer to levels of parity in the public sector here. But I wonder how much effort we need to be putting into helping with with those other aspects to help raise that up in the private sector, as opposed to relying on the public sector, which will not be able to provide enough jobs for everyone, even at, you know, a maximum capacity, but focusing on some of the ways that we can increase or get closer to parity in these private sector jobs. That's just my parting comment here.
Yeah, no problem. On a quick response, you know, day one of econ is about the allocation of scarce resources. And that's the fundamental problem always at any time period, that we have limited resources. And so you always have to target your resources. And I understand that fully, but it's important not to forget the broader scope of things. So yes, if the question is, should we put better money in education? The answer is yes. That's only one thing you got to do. Also housing, also criminal justice, also this, also that. It's not my job, your job, figure out how to do that, by the way. But I would hope that we don't put one versus the other. That's the danger. Really, one thing being the key to salvation. And there's no one key. An important pillar is the public sector for two reasons, once again. One, because it's an existing niche where Blacks and Hispanics find good jobs. But beyond that, the output from the public sector is valuable too. And to the extent that we ignore that, it'd be devastating for folk we care about.
I appreciate your time here.
Thank you. Up next, we have Representative Aurora for the second time. You have the floor, sir.
Dr. Pitts, I just want you to opine on the possibility that we have, that the public sector is brain draining, in a sense that the best folks from one community might be being attracted to public sector, because my personal, and I speak from some personal numbers in certain industries, and I really appreciated you focusing on the industry aspect, that some industries we are not seeing in upper management, or not even upper management, in some of the very high paying jobs, enough participation from all communities, right? And we see that obviously you need that participation. And part of it could be just the training in specific, part of it could be the attractiveness. So the point is that, hell, listen, if I know my dad or my friends are all in finance, and I will be, that's just how it works. I'm sure there's the kind of research or more in psychology on that, if all my friends and family are in finance, I'm attracted to finance. If all my friends and family are in, everybody I know is a doctor, I end up, there's a slightly high probability me being a physician. And so if they're in government service, since I started public service, my kids have already started taking extra courses in government. They were not interested in government, and now they are. So my point being that there is something which I want to ask you, is there a possibility that by attracting the best just in one sector, we may be devoiding the other businesses of some of the highest quality talent in certain communities where they might make 10 times the money in that way? Just a open question. I haven't seen any data, so I couldn't. Maybe I'm just speculating here.
So your kids like long hours, low pay? You're a very bad parent, dude, by the way, okay? That's another conversation to have, okay? But being a bit more serious, I wouldn't quite call it a brain drain. I think the whole question you talked about in terms of networking effects, that I know person over here, I'll follow that person, that pathway is very real. It goes back to what the goals actually are, okay? If the goals are to get group X into industry Y, you find a way to do that, okay? And so networking effects can work against that very, very clearly. I would raise the question of the opposite thing happening. I joked about your joke about your reality of long hours and low pay. That can be repellent also. I think a lot of folks want to do God's work and serve people they care about deeply, but they can't figure out how to pay the bills. And why should I go through the hell of doing that? And so I want to put that out there as well, not to say y'all great, by the way, y'all God's servants, those sort of things, God's children. But the reality is, I think that also is very, very real, that people who want to serve simply find they can't see a way of doing that, either because of pay or conditions themselves. So one, I wouldn't call it brain drain. Two, I do think networking effects are real. And to the extent you want to divert the flow, you will need to examine those network flows and change them. The concern that is real is that we may make public sector unappealing. And I hate for us to do that, by the way.
Thank you. And thank you again for your presentation. I am keeping a close eye on the time here. We're near 4 o'clock, and I want to go ahead and move on to Roman numeral 5 on the agenda, where we'll have a presentation from the state employees regarding staffing shortages. And I would like to start this segment with Rob Burrell, President, New England Healthcare Employees Union. Mr. Burrell, you have the floor.
One quick thing, I'm signing off, by the way, now. I want to say thanks a lot for the opportunity to do this, and I hope for the best, okay? Take care. Right. I'm at your disposal, by the way. Bye-bye,
okay,
guys.
And if we have any questions that come in, we'll be sure to forward those to you, because I'm sure more questions will come up. Thank you again, Mr. Pitts. Bye. Sorry about that, Mr. Burrell. You have the floor.
Thank you, Representative Porter. And I am primarily going to speak about staffing and services, but I think that connected to that is exactly the occasion of the anniversary of Martin Luther King's birth. One of the most powerful speeches he gave was that on the question of the other America. But there was one America where the milk of prosperity and the honey of equality flows freely, and that there's another America where the daily ugliness and fatigue of despair strikes those who are situated in poverty. He was, of course, speaking about questions of racial justice, but also very much noted that poverty is a multiracial phenomenon that affects our white brothers and sisters as well as Black and brown folks. And in terms of state employment, we in 2008 had a state workforce of about 64,000 people. It is now 50,000 workers. There is absolutely a chronic underfunding of private sector wages, particularly in human services that are publicly funded. So if you look at a private sector worker in a DDS group home agency, even with the wages that we fought for, they get to about $34,000. A state worker would be making $44,000, taking care of exactly the same clients, and they would have some additional ability to live based on benefits. Same disparity actually worse, exist in mental health because the private sector has been so chronically underfunded. And so when we talk about that level of shrinkage, 18,000 state jobs disappearing over the course of 13 years, given that these are many of the best jobs that are available for Black and brown folks, for women workers, we were talking about significant erosion of the Black and Latino middle class. So I think that is a very important starting point. In terms of services, though, our membership in 1199, which is a union where we have an almost unequal number in terms of our state membership of Black, brown, and other folks of color and white folks. We're a 50-50 union in the state sector. Our members, take care of folks in DEMIS-funded programs, treating folks with mental health and addiction issues, in DDS-funded agencies, taking care of people with intellectual disabilities, in DOC, taking care of our population in the prisons and jails, and of course in DCF, taking care of children who have been through, frankly, really awful experiences. And we have seen in our membership a 30% reduction in the workforce since 2008. Now, what have we've been seeing in the headlines most recently in terms of what the patient populations that interact with our membership are? What are the conditions? In the city of Hartford, a 10-bed inpatient unit for young adult services, the Hilltop program, closed. We asked when that closure was announced whether the patients were going to be discharged into homeless shelters, because that's what we were hearing from the workforce. The commissioner tells us no. And we literally see children ages 18 to 25, legally adults, but still children, I would say, discharged into homeless shelters. We right now, as we speak at Connecticut Valley Hospital, they're discharging patients from the addictions treatment program, not because they're better, but because there literally are not enough staff to take care of them. Over the summer, we read stories about there being dozens of children, upwards of 40, who had acute psychiatric issues that were being stored in the emergency department of the Children's Hospital in Hartford because there were no available inpatient beds, when 10 miles away at the Solnit Center, we have a 100-bed unit that's operating at a 44-bed current capacity, not because those children would rather be sitting in the emergency department for up to 72 hours in Hartford, but because there are not enough state workers available to fully staff the unit. The human impact of the disinvestment in state services over the past 13 years since the onset of the Great Recession has been catastrophic. And we are seeing the chickens come home to roost right now as we speak. That is a racial and economic justice issue. Okay, we all know that in addition to there being two Americas, there are very much two Connecticuts. And the people who are fortunate, God bless them, to be born in Greenwich or Glastonbury or Simsbury, if they have a psychiatric issue, if they are a young adult who has an addiction issue, chances are that just by virtue of their zip code, there is a treatment program available that mom and dad can afford. Wonderful. When Juan or Jamal in Hartford develops a psychiatric issue and they get put in an inpatient unit, they get discharged to the homeless shelter, as we just discussed. There are real human impacts to the decisions that have been made in the age of austerity to underfund, to defund, to understaff state services. And we are seeing the ways that that is playing out in the news on daily headlines. So when we talk about the impact of potentially upward between 10 and 15,000 state workers retiring in 2022, I suppose we could have a discussion about the potential impact of allowing those jobs to go away by attrition and allocating them for lesser funded private sector jobs, we could have that discussion. Or we could have the discussion about whether that is actually the best thing for the least of these. And at a time where Connecticut is projecting a $1.9 billion budget surplus, at a time when the state has $3.5 billion in a rainy day fund, if this ain't a rainy day, I don't know what is. The discussion that it seems to me that we should be having is about collapsing the two Connecticuts into one, where we take steps towards greater equality in terms of delivery of services, greater equality in terms of privileging our state employees. Because, really, the question should be asked, why do we have a state sector why does it exist? I would say that the number one, we want to set a care standard that, Connecticut is providing the best for people regardless of their income, regardless of whether they were fortunate enough to be born on third base. That's great. Some people are still trying to get to the plate. Okay. Number two, that the safety net is robust enough to take care of everyone. Number three, we should be a leader in terms of wages and benefits so that we can attract, as I believe, single biggest employer in the state of Connecticut, the best quality workforce, and force the private sector to come up to our level, which also means that the private sector also has to be funded. I would say the third thing is that the state should be a driver in terms of racial and economic equity, gender equity. And lastly, of course, we have a public sector to deal with crises. Well, the horror show that we've all been living through for the past 2 years is, as we've talked about, the greatest crisis that anybody on this call has ever lived through. So maybe it's time to begin to resource it in that way by rebuilding our safety net, which is tattered to the point that it's disintegrating. I'll conclude there.
Thank you, Ms. Varela. Some very salient points you made. I think what we'll do is actually go through all of the presenters to hear from you all and then open the floor for Q&A. So up next, we have Amy O'Connor, and Amy is Chief of Staff at AFSCME Council 4. Ms. O'Connor, you have the floor.
Good afternoon, Senator Kushner, Representative Porter, and members of this really important task force. I'm lucky enough to be a Chief of Staff at Council 4. We represent 14,000 state workers across Connecticut, 18 different locals who represent every agency in the state. There is not one agency where there is not an AFSCME Council 4 member. We have clerical workers, we have correctional officers and correctional workers inside every facility in the state. We have social workers, professionals from CHRO to the Department of Labor. We have members in every higher ed department, in all of judicial. Our members have been called heroes in the past year, and we have a lot of concerns what's happening with short staffing. And as Representative Porter said, I think the best thing is for you to actually hear from the folks who live it. Our members, as President Burrell said from 1199, our members make a difference in lives every single day in the state. I know all of you had to see what happened in with the Department of Labor and unemployment claims when the pandemic hit. And that fiasco was caused because we didn't prepare and ensure that we had enough public state staff in the Department of Labor to be prepared for a catastrophe. And right now, in just our clerical unit alone, there are 40% of the clerical workers who have the ability to retire, and we believe will retire by June 30th of this year. And I think it was Representative Aurora, I'm not sure, but somebody mentioned gender. Gender and race, the public employment, state employment makes the difference in every study you look at in the economy of women and people of color. When you look at our clerical numbers, we actually have asked, and so I do ask, if you need, reporting, CORE can give you gender and race. We have asked for that for the past year because we know that in our clerical workforce, it's a majority of women. We know that in many of our units, it's a very high percentage of folks of color. And the pay and benefits have changed the lives of our members and their families' members. But more important than that, they make a difference in the lives of communities. They are child support investigators. They are helping in the Department of Social Services. They help in higher ed and residence halls. In every situation of folks' lives where they may be feeling vulnerable, our members are there, not because they get a good paycheck and benefits, it's because they love their communities. They're there to serve. And I can't tell you how important every one on you in this task force is to the economy, the safety, and the stability of the residents of Connecticut. So I would love to introduce Anna Lindley to speak to you on what she's encountering in judicial.
Anna, you have the floor.
Thank you, Madam Chair. Good afternoon, Senator Kushner, Representative Porter, and members of the task force. My name is Anna Lindley. I'm a certified Spanish court interpreter with the judicial branch, where I have worked for 18 years. I am also regional vice president with ASME Local 749. Over the last decade, understaffing has hurt the public and the members of my department. 10 years ago, we had 30 certified Spanish court interpreters. We now only have 20. 10 years ago, we had approximately 10 temporary Spanish interpreters. Now we only have 5. Despite the deep cuts in certified and temporary interpreters, the population of limited English proficiency, LEPs, has increased tremendously in the past 10 years, more so in the past 4. Due to shortage of certified court interpreters, staff is cutting corners by using untrained ad hoc interpreters, such as defendants' family members, their own children sometimes, to interpret for preliminary interviews. This is problematic for ethical and linguistic reasons. Among others, ad hoc interpreters are not trained in legal vocabulary, thus creating a discrepancy between what the defendant hears in the informal interview and in their hearing when they're in front of the court, interpreted by an official certified court interpreter in proper legal language. Many LEPs are American citizens, yet they're treated like second-class citizens due to the lack of adequate language access. For example, their cases are often continued several times due to unavailability of interpreters. This inhibits non-English speakers access to justice. Now, in order to address the staffing shortages, Judicial has been contracting agency interpreters daily, spending thousands of dollars a year. This is a temporary solution to a long-term problem. Some interpreters retired, some went to work in other states, some went to work for the federal government. A few left because there are no permanent part-time positions available. Retention is an issue with temporary interpreters. They're trained for 4 to 6 weeks. They stay with us for a few months to a year. Then they take the rigorous certification exam and most fail it. What happens next? They're let go. These interpreters take their judicial training and experience and go work for agencies, those same agencies that we contract from. Court interpreting requires advanced vocabulary, legal knowledge, experience, education, training in ethics, none of which are adequately compensated. In addition, current compensation is not adequate to attract new certified candidates to our department. The hourly rate for a temporary interpreter is $17.23. 18 years ago, temporary interpreters earned $13.78. In 18 years, the increase has been less than $4. $17.23 an hour does not offer a living wage, especially considering the rising cost of student loans and raising a family. There are several remedies that can help to improve the situation of short staffing. For example, some courthouses have discontinued the use of virtual hearing equipment, which would enable us to continue to offer certified interpreting services on demand. We could be in 5 different courthouses in one day. We need to continue to have access to this equipment so the public can be better served. We should also invest in training and retention of interpreters. We also need wage increases equivalent to the skills needed for the job and to help attract new candidates. Ensuring the courts retain experienced interpreters and can attract new ones is important so that everyone can have fair and equitable access to the court system. And another point I wanted to say is that we need to keep in mind that we are the new coming force. The new employees would be what we call the millennials now. They have a different view of what good job is. They're not concerned about medical. They're not concerned about retirement pensions. They are concerned on today and now. And they're not afraid of going from job to job. So we need to make jobs attractive to that new target population in order to be able to recruit them and to work for us. Thank you for your time.
Thank you. Thank you. Up next, we have Amanda Tower, Corrections Officer for ASME, Council 391. You have the floor, madam.
Almost forgot how to unmute myself. Good afternoon, task force. Thank you for having me. My name is Amanda Tower. I'm a correction officer with 8 years on the job, currently at McDougall Walker Correctional Institution. I'm a union steward with ASME Local 391. The negative impact of the staffing crisis in the Connecticut DOC gets worse every day. As of last fall, the agency was already more than 400 staff short based on their own formula, with 400 more of our frontline employees anticipated to retire by July of this year. Hundreds of staff are out on leave because they tested positive for coronavirus. Many of us are working mandatory double shifts several times a week, and so many of us at this point are burnt out. The DOC knew this crisis was coming and chose to wait until the last minute or blame it on the pandemic to address it. We became classified as critical employees during all of this, yet the agency went with a wait and see method to fill the gaps in our critical roles. People are retiring, transferring, or completely leaving the job at this point, and the number of new hires barely covers current vacancies. The staffing crisis is causing further fear and confusion within our ranks. One of the most dangerous feelings a person can feel who is already under intense stress is helplessness. It often leads to hopelessness, which causes negative emotions and maladaptive coping mechanisms to take over. People spiral out of control and don't take care of themselves. They abuse substances, they become depressed, and potentially commit self-harm. We're putting a lot at risk by even showing up to work at this point, and our professionalism can only be carried so far. We are all human too. Staff are overburdened, causing training our new staff inside the facilities to no longer be a priority. We tried to close this gap by releasing offenders and closing facilities, but that has backfired, leaving us with nowhere to house COVID-positive inmates, and it has significantly impacted programming and rehabilitation for the incarcerated population. We believe the state is playing a shell game with many of these numbers, along with the staffing issues. Opening an additional facility temporarily to facilitate safer isolation practices and allow for social distancing where practical is a good solution, but will only exacerbate the staffing crisis. Instead of working together with the labor unions and actual boots on the ground, administrators are refusing to agree to safely staff our prisons with the available resources. We were called heroes last year, yet we keep being told to just wait for positive change. The time to wait to see Wait and see has come and gone. It would take a miracle to solve this problem in a timely fashion at this point, but any massive action to help recruit and retain staff is better than none. It's unfortunate that this is where we are, but the time to act is now, not after some major tragedy takes place, which is the outcome we all walk into work fearing at this point. You can help prevent this instead of having to respond to it. And I'll end there for now.
Thank you. Up next, we have Seth Freeman, President of Congress of Connecticut Community Colleges. President Freeman, you have the floor, sir.
Thank you very much, Representative Porter. Hello, task force members. My name is Seth Freeman, and I'm a professor of computer information systems at Capital Community College and president of the Congress of Connecticut Community Colleges, the 4 Cs. The 4 Cs represents nearly 3,400 full-time and part-time faculty and professional staff at our 12 community colleges. As we discuss this important topic today, our union wants to begin by expressing that there's already a staffing crisis in the Connecticut Community College system. This crisis will certainly be worsened this July, but the understaffing crisis is already underway and already negatively impacting our students. Understaffing is a contributing factor to low enrollment in our community colleges, and it impairs our colleges' abilities to fully fulfill our mission in serving our students and communities. In our union membership across the last 5 years, there has been a 30% decrease in staff, nearly 16% decrease in full-time staff, and 42% decrease in part-time staff. This decrease has occurred through attrition, primarily through attrition, whereby full-time faculty and staff retire or leave state service without being replaced. This decrease also occurs through an already over-reliance on part-time educational assistants who are offered short-term non-renewable positions. The problems that occur through this is that as staff have retired over the past years, their positions have not been filled, and the additional work is then placed on the remaining staff. Our remaining staff, our current staff, report working well above the 35 hours per week that they are supposed to. On average, our staff who respond to a survey, so they work 45 hours per week. Additionally, as our full-time positions are not being filled by full-time permanent positions, but rather full-time positions are being filled with temporary part-time positions. So generally speaking, understaffing in our student services has led to increased demand on the remaining staff. For decades, the mantra in our community colleges is simply to do more with less. Frankly, my peers and colleagues often don't complain because we're committed to serving our students. But the reality is that when positions are not refilled and our staff are overworked, this inevitably leads to decreased services for our students. So what does it look like for our students? Students are unable to find the resources on our college campuses when they need them. There are reduced hours for critical services our students need, such as the library, cafeteria, career services, information technology support. Critical processes such as awarding of financial aid are delayed, resulting in students having difficulty accessing financial aid. And also through this pandemic, our colleges have seen a severe lack of mental health services for our students. I could spend this entire statement just focusing on that. It's worth noting that this current consolidation of our community colleges that's underway is not resolving or improving this crisis. I won't focus on that in this brief presentation, but it's worth noting that the consolidation is not prioritizing refilling these vacancies, but rather is prioritizing hiring managerial positions while attributing savings or misattributing savings to the attrition and lack of refilling of faculty and staff. The Board of Regents for Higher Education reported over the past year that 30% of its employees are eligible to retire this June. Much of that is already underway. The decline in services that we have already seen will only increase if staffing levels for faculty and staff who directly serve students, not management and system offices, are significantly increased. And the point that we want to make is it's not enough to just get back to, it's not just a matter of refilling vacancies, but we need to have an increase. The understaffing of our community colleges is an equity issue. Underfunding community colleges hurts the largest population of college students in Connecticut. Understaffing hurts the largest percentage of low-income college students, and it hurts the most ethnically diverse population of college students in our state. Understaffing prevents our colleges from completing our mission of providing pathways to higher education for students from marginalized communities who are often underprepared and need the most to pursue and achieve their higher education goals. Understaffing prevents our community colleges from being the engine for equity and advancement for our residents and the engine to support industry and further advancement to pathways in higher education. So I appreciate the opportunity to share the perspective from our community colleges, and I appreciate the work the task force is doing. Thank you.
You're welcome. Thank you. Up next, we have Christine Jean-Louis, Assistant Attorney General, President, Connecticut Association of Assistant Attorney Generals. You have the floor, madam.
Just give me 1 second. I put my camera on and I have to just switch.
Take your time.
Okay, can you guys see me okay?
Yes, we can see you and hear you.
Awesome, sorry about that.
That's okay.
So good afternoon, everyone. Thank you for allowing me the opportunity to present on the impact of retirements and understaffing in my office. I'm here with the knowledge and support of my administration. My name is Christine Jean-Louis. I've been an AAG for the past 7 years and president of the union for the past 3 years. Our office is majority women among both lawyers and staff. We are doing better than our legal counterparts when it comes to gender and racial diversity. My office serves the state of Connecticut either through the general public or directly through state agencies. So the lack of continuity in the work we do can be detrimental to those we serve because many of our work can go on for long durations of time or require specialized knowledge gained over years of experience in the office. If we are litigating a matter, it may be in litigation for years or contract negotiations may be ongoing for months. If we're investigating an entity or a person that's violating state law, the investigation usually is ongoing for several years before we file a complaint. So continuity is crucial. As you may or may not know, last year in February or March 2021, my administration presented before the General Government B subcommittee of the Appropriations Committee to kind of begin ringing the alarm on staffing and retirements that we anticipate for 2021 into June 2022. Our agency consists of 300 people, roughly 200 of which are lawyers. We have very little turnover, which is a good and a bad thing. With rarely having turnover, we have about a quarter to almost a third of our office eligible to retire. For lawyers, we have roughly 50 lawyers eligible to retire, which does not include an additional 30 or so attorneys who can retire early with penalty. I've watched some of your meetings as a task force, and I saw from DAS's standpoint, the retirements are not yet a concern, but I think whether it is a concern or not is going to be dependent on the agency you're looking at. And the devil is going to be in the details here. So if an agency has over 1,000 employees and 50 are eligible to retire, then they may not notice an impact unless all of those retirements are happening in the same unit. But for my office, having 10 to 15 lawyers leave in any given year is already a lot, let alone the anticipation of 50 lawyers. We have 12 units, and each unit is directly impacted with a handful of attorneys and staff that are going to retire. And again, that doesn't include those who can retire early with penalty. So for example, my unit, I'm in the Infrastructure and Economic Development Unit, which is formerly known as Transportation Unit. And there are 11 attorneys and 2 staff. We have 3 attorneys and 1 staff eligible to leave from that group, and 2 attorneys and 1 staff have already confirmed they are leaving. And other attorneys tentative. So if you just look at us as a small snapshot, and we're one of the smaller units, there's at least 6 attorneys eligible to retire in the other units and 3 or 2 staff members eligible to retire. So the impact is pretty great across the board. So I come here today to kind of reiterate that retirements are real and understaffing for any duration of time is a major concern for our office. The way we combat that is by allowing overlap in hiring. So outgoing AAGs can train incoming AAGs. And why is that important? Well, if we're not hiring AAGs with several years of experience to hit the ground running, We have a learning curve for some newer AAGs that are less familiar with the work. And depending on the unit assigned, it might mean that it takes a few weeks or months for them to manage cases entirely on their own. And allowing some overlap gives us an early start with training and the continuity we need with cases so there's a smooth transition. Our office has gotten into a good rhythm of kind of shortening the hiring process internally, but having the external process, such as OPM approvals and any other necessary approvals we need to get hires done and have those prioritized, can allow us to have the overlap that we deem is necessary to greatly help our office from the pressure that could exist and would exist from the unprecedented amount of retirements that we see is happening in a short period of time. Again, when you're an agency like ours that has a very low turnover rate, the anticipated retirements that has already begun and that we know is going to happen in the next few months into the end of June is a major concern. And there is this is completely different from the normal attrition we have each year where attorneys may leave for better opportunities or because they get a higher pay somewhere, or there's just something that's drawn them outside of the office. So we're currently experiencing that, and that doesn't stop. But we don't want to overstretch some of our units that already have been stretched to their limits, and we don't want to slow down the work we are in the midst of doing on behalf of the state. So anything this task force can recommend to help us have an overlap with hiring during this very short period of time would help reduce any impact understaffing would have as a result of these, again, unprecedented retirements we see coming between now and July, and they're real for us. Thank you.
Thank you. And I hope you'll be able to help us with that. Up next, last but not least, we have Captain Tara Keaton, Department of Corrections, Executive VP of Corrections Supervisors. And you have the floor, madam. You're on mute. That's okay. Yes, there you go.
Okay. Good afternoon. I would like to thank everyone for taking time out of their busy schedule to come listen as I speak about understaffing and racial gender equity within the Department of Correction. My name is Tara Keaton, and I am a captain for the Department of Correction, and I'm also the Executive Vice President of the Correctional Supervisors Council. Understaffing has been detrimental to supervisors and frontline workers' mental and physical health due to the long hours worked, double shifts, and lack of sleep, maybe 2 hours, not to mention the effects it may have on our families as a whole. I feel that due to the pandemic and with the corrections already being understaffed, this would be a bad time to implement changes in the retirement system when there is not already enough staff. We can not hire enough staff to replace the ones that are leaving. Delaying the implementation of the pension and healthcare changes scheduled for July 1st, 2022 for hazardous duty employees in corrections, the so-called silver tsunami, would help alleviate some of the understaffing problems within the agency. If the staff that are scheduled to retire were offered an incentive to work, and the work would be beneficial to all that will continue to work beyond July 1st. You would also have a well-rounded staff member working on a more thought out transition process. Throughout my tenure in the department, I have witnessed well-qualified staff that have not been provided opportunities for advancement. There is an affirmative action process that is in place for diversity, but based upon the number of applicants applying for position, it has not reflected the people of color and women in corrections, nor does it reflect the offender population in our jails and prisons. The number of people of color being hired versus the number being promoted is very low. This also has an effect on the promotions when not enough officers are being hired in the department. I am grateful for having a state job because this is one of the opportunities to get people of color out of poverty, and would hope that this process will continue to open doors for many minorities following me. Thank you for your time, and I would be happy to answer any questions you may have.
Thank you, Captain Keaton. Thank you all. You really did bring some great information, great points, and in making the point and really bringing clarity to why this task force is so very important. I can tell you some of the things that I actually gleaned in listening to you all was what you actually just said, Captain Keaton. You know, the more money people make, the better their wages are, the better healthcare they have, retirement packages. It helps to level the playing field, and it improves not just the quality of the workplace, it improves the quality of the worker's life, their family's life, and overall the quality of the community in which they come from. And I think there's been a theme going here where we see that, you know, there is a difference, right? We are looking at racial and economic inequities that need to be addressed, as well as the tsunami that is impending. So with that, I'm gonna go ahead and open the floor and ask anyone who has any questions to please raise your hand, and we will start with my co-chair, Senator Kushner.
Thank you, Representative Porter. I have a comment rather than a question, and it's more of a regret than even a comment. And first of all, I should say I really appreciate hearing from all of you about your work circumstances. And, you know, over the last 3 years, I've learned a few things from Representative Porter. She's known the people closest to the problem are closest to the solution. And, you know, clearly hearing from you today, that was so emphasized by your reports. And what concerns me is, and one of our panelists said this very well, said that, you know, in listening to the previous, I think it was Christine, but listening to the previous reports from DAS, it sounds like everything's on track, we're okay. You know, we can handle this and we have good ways of addressing it. And maybe from 1,000 feet, that is correct, or it seems correct. But I think your point that this impacts the unit and the departments in very different ways was extremely important. And all of your reports, the regret I have is that we didn't start with this panel at the very first session, so that we were armed with this information when we met with the departments. But I do want to assure you that, you know, that while this may seem like the end of the process, because it's getting toward the end of the month and session is upon us, it's not by any means the end of the process, because we know we have a lot of work to do this session to try and do everything we can to both see this moment as an opportunity where there are retirements and we're going to be doing hiring. There's an opportunity there for us to be intentional and get it right and hire people that will actually expand gender and racial equity, and also see this as a moment where if we don't get it right, we can be set back as a state tremendously in many, many ways, most importantly in providing services to the people. And, you know, so I really appreciate all of your comments and want you to know how important it is that you took your time out of your very busy schedules to be here with us today. So thank you.
Hey, any further comments or questions? I don't see any. And I will just echo all of the sentiments that our Senator Kushner just expressed. And thank you all again for your presentation. And I do see we have Dr. Al-Qadri with his hand up. So you have the floor, sir.
Just a quick question to the Attorney General's rep and to the folks working with corrections. Are you having a hard time finding qualified workers for the postings that you have? Because this is something we've talked about in this task force, is the accessibility to a workforce that's available to take on these jobs.
Fortunately for us, we do not have an issue. Our office provides really stellar work, and a lot of people are usually lined up to kind of join us. So that's never been a problem. The problem has always been not being able to hire them until someone leaves. And with us having the amount of retirements that we anticipate, that's going to be a big issue, because it's one thing when you have like one or two coming in any given year or even within a few months period. But when you have between now and July, every single unit having 2 or 3 new attorneys coming in, that's a lot. And that puts pressure on everyone else that's already there to kind of take up the load, because those attorneys can't kind of hit the ground running right away. So the overlap, that's why I said for us, it's not a hiring issue. For us, it's going to be being able to hire people and overlap with the people that we know are leaving.
Is that it, Dr. Al-Qadri? You disappeared on my screen. Oh, there you are.
Sorry, I'll speak on corrections. With corrections, I believe it's more of a retention. And because lately what have been happening is they've been hiring people that have degrees. So they'll come in, and then once they find another job, they'll quit. So I think it's more so the retention, retaining the members and retaining the staff. As far as my union, we don't have a problem, but I think far as on the officer level, it's more of a retention issue.
So I guess I'll ask the question. Yes, and I see you, Danny. Real quick, are there any incentives that are being offered, with these agencies, because there is an issue of retention? No? Okay. I see you going no.
Not that I'm aware of.
Cap, do you mind if I jump in real quick?
Absolutely.
I think a lot of it at this point is the frustration, the confusion, and the just straight up being burnt out. I've seen and heard across the state people with years on the job being fed up with the mandatory doubles, with the conflicting direction being given by administrations from various levels. We went into a snowstorm on a weekend where all of a sudden the administration was just like, no more days off and no swaps for shifts. So now we're completely just telling our staff, hey, figure it out. We need bodies to fill the posts, and that was quickly overturned, luckily. But there's not a whole lot of communication to the line staff that are currently on the line. And for a lot of people, family is everything, health is everything. I thought I had COVID this morning, took a rapid test, and luckily I don't. I'm probably just physically exhausted and my immune system can't handle it anymore. It's happening all over the place, and people just, they're not prepared to just wait and see. It'll get better.
Thank you for that. I mean, and there's certainly go ahead, Christine.
And I could add to that, because I know we had one unit during COVID, they had that burnout situation, but our burnout situation again was different because of the hiring, because when we had people who leave, that meant everyone was stretched out to get the work done, and the new person didn't come in until months later because of the way the process was. And then that person needed to have time to get in. But we've had to address mental health issues and self-care with a lot of attorneys because they were just physically, their bodies were physically manifesting the burnout and the stress that they were having to get work done. So I think that is a real concern for a lot of agencies and a lot of state employees.
And I just want to say real quick too, with corrections, I know nobody can really argue the numbers, they're right there on paper, but all of this translates as well into the incarcerated population, which is also a part of our communities that we're working with, as well as the public that interacts with them and interacts with us. Having individuals who are isolated, who don't have any control, who do not have any clear communication, it completely changes the climate, and it only makes things feel worse. There are plenty of words that I would like to use about it, but it's extremely uncomfortable and foreboding.
Absolutely. And thank you for highlighting that, because we know when you guys are short-staffed that there's a lockdown occurs, and everyone, warranted or not, is pretty much placed in solitary confinement. And, it goes back to what President Freeman was saying when he said, do more with less. That was the first thing that popped in my head, burnout, because it has been reported that, that is one of the number one factors why, they're calling it a worker shortage, but it's actually not a worker shortage. And it impacts the equity in services and also the quality in services that you were just referencing. So we'll go on to Mr. Livingston, because I know you had your hand raised, and then we're going to try to figure out what we're going to do with the time we have left, because we still have higher ed to go. Mr. Livingston, you have the floor.
Thank you. I have a question, and then I'll follow up with a comment. But let me start with a question, and Christine may be the right Christine Jean-Louis may be the right person to ask this. But we haven't talked about revenue generation from state workers yet. You know, one of the things we know is that there are a number of retirements pending or likely in the Department of Revenue Services, which of course, when we're understaffed in revenue services, we don't collect as much in taxes, and so it's a spiral. You know, that we end up with less resources and more understaffing in other agencies. Christine, am I right that you all had some figures about revenue generation by the Office of Attorney General?
Yeah, it's no secret that we outpay ourselves as far as the cost to having us by huge dividends. We bring in millions of dollars to the state just based on the investigations that we bring. So naturally, if there's a staffing problem, those investigations that we normally take to collect money like that usually takes years or a lot of resources, those get slowed down, or we have to prioritize investigations that that we could do with the staff that we have. But I think the committee is aware that we bring in a lot of money, millions and millions of dollars for the state.
Yeah, thank you. And then I guess the comment, you know, hearing from so many of you, and thank you all for coming today. I think the question being asked of us is how much disparity in justice and opportunity we're willing to tolerate as a state. And we've gone decades now bragging about reducing the number of state workers whose job it is to take care of folks, and particularly folks with the least resources of their own. We brag about that. We brag about being, you know, down 10% in the state employee workforce. At the same time, if we bring in 20 people in the private sector, some governor somewhere holds a press conference about the 20 new jobs, even though we're down 2,000 or brag about being down 2,000 or 20,000 in the public sector. And so the result of all that is the predictable known unfairness in opportunity and in the daily lives of so many people in the state. And what I think we heard from people today is, you know, we're choosing to make it worse. You know, we're choosing, if we don't act, if we don't do something about this retirement cliff, if we don't do something about understaffing, we are choosing to knowingly make the unfairness and injustice in our state worse for literally, you know, millions of people or hundreds of thousands of people. That's the question I think being asked of all of us. Will we tolerate that, or will we propose solutions that will address that? And I'm very grateful for the folks who came and made that clear today.
Thank you, Mr. Livingston. I want to ask that the higher ed representative, I'm not sure who that is. Can you raise your hand for me, or come on camera and unmute?
I think we're talking about the representative who's going to present in the next section on higher, not the panelists here, but I think we had a couple of people we thought were with us today to do the presentation about higher ed and what the plans are. And
yes. And I don't see anyone responding. That was a call for the Office of Higher Ed representative. That is actually Roman numeral 7 on the agenda. There's no one responding, so we may not be in the trouble we thought we were in, because we were going to try and figure out if we could stay a few minutes longer, or so. I mean, we do have 18 minutes left. So Senator Kushner, I would welcome, you know, an open dialogue to further discuss where we're at right now with the presenters that just presented. Monica, I see you just came on. Yes, there you go. So I'm sorry, Dan Callahan, and then followed by Monica Nugent.
I wanted to provide a response to some of the earlier questions, specifically from Dr. El Khadroy and from the chairperson, from you, Madam. The former, that the chairperson had asked is right now there are no stipends or incentives being given. The state is, not that I'm aware of, other than we have looked at hiring rates in different aspects. They're very hard to obtain. There's a lot of justification needed to give to get somebody in at a hiring rate. But right now there's none that I know that are blanket. And from the transportation standpoint, that is something that the transportation industry obviously is doing. So that is a hindrance to us in getting good qualified candidates and increasing our pools of candidates, especially for CDL drivers. We do have a fairly high vacancy rate right now, and we've got more coming as we head into the spring, into February, March, and April. And so you typically can see $2,000, $3,000 hiring bonuses for school bus drivers and other people who have those skills that are so short and in demand in not just public sector, but in the private sector also with the shortages that are out there. So unfortunately, we're not able to maneuver like the private sector in obtaining those candidates. And secondly, Dr. El-Khadroui had asked some questions regarding, I forget the exact question of the panel members, but basically, we are at a disadvantage as we go into this as far as salary-wise, attracting candidates. So when we're trying to hire people, it's an involved process, and it is somewhat bureaucratic as far as the state goes. I know the BCG report is out there. I was fortunate enough to participate in it. And there is an outline of the refill process we really need to look at, I think, as part of this committee. The ability to auto refill on agencies' parts is very narrow right now. And the less time that we have HR people spending and working supervisors spending doing justifications and going through the 7 steps of the refill process, the quicker this can happen. And if we have what we call auto refill in the state, I think that will definitely help us in getting candidates quicker, getting postings up quicker, getting applicant pools built quicker. And so that is another part I think that we need to really seriously talk about as we go forward.
And Mr. Callahan, just for those who don't, can you just speak a little more about the auto refill in the state that you're referencing? What does that look like?
So basically, certain classifications have automatic refill. Right now, we have it for maintainer 1, transportation maintainer 1s. And it is it's granted by OPM for certain job classifications. And so those are very tight usually. I'm going to assume that classes such as correction officers and medical staffing has been given auto refill in other agencies. I'm not quite aware, but we may want to ask through Lee Hansen, how many classifications have auto refill right now? I think that's important to find out, and whether that can be expanded through OPM by the granting of that to agencies. Based on the immediate staffing needs that are needed right now, and the resources, the limited resources that we have available to dedicate towards getting staff on. So right now, HR over the last 2 years during the pandemic has been constrained with duties they might not have foreseen coming our way. And that includes the coordination and approval of the telework plans that have gone into effect, the COVID-19 non-compliance tracking that we have to do for the testing that goes on, and in addition to our normal duties. So, going through that justification process and going through the levels of approvals, although it may seem routine to a lot of people, it is time consuming. There are places where gaps can happen. And so auto refill would be very beneficial, I think, to the agencies.
Thank you for that. And thank you for that recommendation. And I see that we do have Mr. Hansen on from OLR. So we will ask that information be gathered and shared with the task force members. Ms. Nugent, you have the floor, madam.
Good afternoon, everyone. Thank you so much. I just, not so much a question, but more of a comment. Just, it's no secret that I am the president of Managerial and Exempt Employees United, a local of AFT, and we represent the non-bargaining unit managers and exempt employees in state service across all branches of government. And I just want to thank, the members of our brother and sister unions for making these presentations and really putting faces to the numbers and everything that we've been talking about in this committee, in this task force. Hearing especially about, children being put in homeless shelters because there's not enough staff to take care of them is horrifying. And I believe, as a state, we should really be ashamed that that's what's happening. I don't think that should ever be the solution for anyone who is in need. And so I just wanted to say thank you. And, on behalf of my members as well, many of these issues are happening within the exempt and managerial employees. Most managerial employees are women. They face compression and inversion issues in their salary. There have been discussions about, discrimination and pay equity issues amongst the managerial class because of the compression and inversion issues. And many of the things that are being brought up are happening in that class as well. They're short staffed. There's not enough people to manage the priorities set by the administration. And you would think that it would be in the best interest of the administration to make sure that all these different levels are staffed adequately in order to meet the benchmarks and the goals that they set out. So just wanted to comment and say thank you once again.
Thank you. And Mr. Callahan, is your hand still up from the last time, or did you want to speak again?
No, thank you. I'll take it down.
All right, thank you. So yes, I do believe that, yep, you put it back up. Okay.
Sorry, I thought I lowered it.
Like he changed his mind.
No, I did not.
Well, yes, I mean, Monica pretty much summed it up really well. Really appreciative of everyone that came on to speak and to share your lived experience. I believe that is very important. We have a lot to chew on, and I thank you for bringing a different perspective, a very important and critical perspective to this conversation. It's quite apparent, I think, to us all. And as the labor co-chairs, I think we can definitely speak to seeing this within the agency at DOL. The fact that it started pre-COVID and COVID only exacerbated what was going on. And I have to keep going back to quality of care, quality of service, equity, all of that, because the folks that suffer are not only the workers, but the people that they're providing these services for. And we're still getting calls. So we definitely need to come to some kind of solution. And I'm hoping that we will be able to do that together in a way that is mutual, effective, and efficient for those who have been serving us with their whole heart and soul. And I just really want to thank you guys because I do see you as essential workers for the work that you've done and for the way that you have been steadfast throughout this pandemic and taking care of the people who are counting on you to do just that. I will leave an opportunity at this time for my colleagues to have some closing remarks, and I will start with my co-chair, Senator Kushner.
Thank you, Representative Porter. As happens so often, we've been working together so intensely for the past 3 years. We often say the thing that the next one was going to say. And, I really appreciate your acknowledging the workers who were here today and your representatives, because having been a union representative, I know how intense it is when your workers are suffering, when they are struggling, you are struggling too. So I want to thank everyone who spoke on the panel today. I think that COVID brought a lot into focus for us. We were aware of understaffing in certain agencies, but it became much more critical during COVID and during the pandemic. And when people truly relied on government just to get by day to day. And, your work is so essential to what we're trying to accomplish in the state, taking care of our communities. And I know that, it was particularly difficult for many of you who had to go to work. And I know you risked your lives and the lives of your families. Some families didn't fare well during COVID. We lost people. The first person to die in the state of Connecticut from COVID was a probation officer. He actually comes from my area. He came from my area, Brian Coela, and it was devastating for so many. And I want to thank you for being able to present so clearly and so calmly in a way when I think that the last 2 years have been anything but calm for all of you. We know that you are our heroes, and we thank you so much, but we also know we have work to do, because thanking you and calling you heroes is not enough. So I know Representative Porter and I are going to focus on the needs of not just our public sector workers, but all of our essential workers throughout the state. But you all were a big part of this. So thank you for being here today and keeping us well informed about your circumstances, because your circumstances are the circumstances that every resident of the state feels when they need to contact government. And so it was very helpful to us today. Thank you so much.
Thank you, Senator Kushner. That's so true. We need bodies. Technology is a wonderful thing, but when you are at your wit's end, you want a live person on the other end of that phone, and you want to be able to go in and see a live person. With that, I will go to Representative Aurora, the ranking member in the House. We can't hear you, Representative.
Is that better now?
Yes, we can hear you now.
Okay, thank you. Thank you. Thank you, Madam Chair, and thank you to everyone who presented today and gave us the insights, these specific insights, and welcome to a new participant here as well. And
yeah, the cutie pie.
And I think we heard a lot of things. From my perspective, it was important to kind of listen and also make sure we hit all the notes as we go through the study. The transition planning note, which we heard in specific, that there's not somebody coming to the job, or the new person takes a long time to get on with the taking on the responsibility, and that creates a lot of stress. And that's an addressable problem. I think that's very important. Training and taking care of the shortage that may happen, or hiring properly and aggressively to replace those who are retiring, is extremely important. I think there was obviously a little bit of mismatch what we heard in terms of the staffing levels, what we heard from management earlier and what we heard today. And I think that's a very healthy discussion which we heard, and I think we need to make sure that we take all points of view in that to find the right solution. And so I thank everyone for participating. I think there is some very a good shaping up of ideas here, which is exactly the purpose of convening something, a task force like this. I do think, we spoke a little bit about technology in the past as to how to help technology be a tool, not to replace bodies, as you just said, Representative Porter. Machines will never replace humans. Machines will always help humans be more effective and possibly take some of their rote load away, or some of their repetitive things away from them. So all of that has to be really included. Effective use of technology, not technology as a replacement of training, of transition planning. And these are extremely important things, best practices across the agencies. So once again, thank you to everyone for giving us these insights. And I'll be chewing on them for more than a few hours here and reading up on some of the stuff that is being sent to us to make sure we do justice to this task force from our end. Thank you, Madam Chair. Back to you.
Thank you, Representative. And Representative Mastro Francesco. If you would like to have any closing comments, you have the floor, madam.
There we go. Thank you. No, I think with the task force has been really good. We've gotten a lot of good information, which I think is really critical for what we're going to need going forward. I appreciate everybody's input today. Great presentations. There's just a lot of information out there. It seems like we have a lot of work to do, but I appreciate everybody's comments today. Thank you, Representative Porter.
Thank you. And I do believe that will actually the announcement of our next meeting. What's that? Take a look at my calendar. That will be February the 1st. Can you all believe that? We will be meeting on February the 1st. Wow, 1 month down and 11 to go. And it will be at 3 p.m. Tuesday, February the 1st. And at this time, I will go ahead and adjourn the meeting at 4:59. We actually got through a minute early. Whoop-de-doo. I wish you all a great afternoon and a blessed evening. Thank you so much for being with us today.
Thank you.
Thank you.
Bye.
Bye, Emil.